Welcome to our deep dive dialogue on optimizing digital pathology workflow, best practices for successful implementation. Digital pathology is rapidly transforming the future of pathology, offering new ways to enhance diagnostic accuracy, streamline workflows, and integrate advanced technologies like AI. We will examine how laboratories can adapt to evolving innovations and implement best practices for successful digital pathology workflow optimization. By focusing on practical solutions and forward looking advancements, we aim to provide actionable insights for labs transitioning to a fully digital pathology environment. To discuss this, we are honored to have today Dr. Rajendra Singh with us. Dr. Singh is the co founder of Path Presenter, a leading digital pathology platform with over 50,000 users worldwide. He serves as Director of Dermatopathology and Digital Pathology at Summit Health and has worked with top institutions such as Northwell Health and Mount Sinai. Recognized for his educational contributions, he has won numerous awards, including the CAP Lifetime Achievement Award. Dr. Singh is the editor of educational platforms like My Derm Path Plus and has authored key texts in dermatopathology. He also plays a leadership role in WHO and CAP's digital pathology initiatives. Welcome, Dr. Rajendra.
Thank you very much, Dr. Khurana, for having me on your platform. It is a pleasure and an honor to be on this platform.
So, sir, in what ways is digital pathology transforming the future of pathology field?
Yeah, so like it's a very transformative technology, although it has been around for some time now. So if you look at the field of pathology for the last 100 years, pathology was being done with glass slides and microscopes, and people would be waiting for the report for multiple days before they can get a report. But in the last 10 to 15 years, we have now technology that can take the glass slide and then scan it into a digital image that can be viewed on the computer, essentially transforming your computer into the microscope. So whatever you do on a microscope, like viewing the slide, zooming in and zooming out, rotating the slide, all of it can now be done on the computer. And you can like easily imagine now, if I have a digital image on my computer, the amount of things that can be done with that image. The technology on facial image recognition has brought in so much of new kind of technology that can be applied to images, that allow you to do artificial intelligence, that allow you to like see patterns within the image. So with this transformation of analog to digital pathology, where you now have a digital image of the tissue, a lot of possibilities open up to use the image in a much more efficient manner and help the patient in the best possible way. Because in the end, as physicians, all we want to do is make sure that the patient gets the right treatment and they get the treatment at the right time. So digital pathology is helping us do that in a much more efficient manner.
Right, sir. So, in what ways does computer assisted diagnosis, CAD, improve pathologists' accuracy and efficiency?
The artificial intelligence, if you look at that, it's the second step of what like digital pathology will enable. So if you step back a little bit, if you have digital pathology, there are so many other advantages that we first can like highlight, and then we come to the artificial intelligence part. So let's say I'm a patient sitting in India, or I'm sitting in another country where I get a diagnosis of a cancer diagnosis. My first thought is always like, can I show this case to another person? Like, can I confirm my diagnosis? That is the first thought that always comes to any patient's mind. And previously, like if you wanted to get a second opinion for say somebody sitting in India or somebody sitting in Japan or America, like you put the glass slide in an envelope, and then you would send the slide to somebody that is sitting across in another continent. And you can imagine like you have to wait 2 to 4 weeks before you hear back from that pathologist or from the department that this is your diagnosis, or many times if you're lucky that this is not the diagnosis, this is you don't have a cancer diagnosis. But now with digital pathology, you can like just digitize the image, and within a matter of minutes, you can easily like get the slide across to the other pathologists wherever they are. And they don't even have to be in the office. They could be sitting at home. They might be on vacation. They can still look at your slide and immediately provide you with at least some kind of a preliminary diagnosis, and that would help the patient in a very big way. So that has been the biggest, I think, game changer for patients. And obviously, like, uh, if you look at a department, like you might have a hospital that has five different centers in one city, like like in a city in Bombay or Delhi or any place, there might be five different centers, and each center cannot have the best pathologist in every center. They might have a very spectacular neuropathologist sitting in one center serving all the five different hospitals. Now, trying to send these cases from these five different hospitals to that one neuropathologist, it always takes time, and you can lose the case while in transit. It can get delayed. But now with digital pathology, it is very easy to like transfer all the cases to that one neuropathologist, so that all the five centers, all the 10 centers in one city, in multiple cities, can now get a very easy access to the best pathologist. So you're not only now be able to get your diagnosis in a faster way, but also you can make sure that the cases are assigned to the best person that can make the diagnosis. So that is another big game changer that digital pathology brings to the system. And as you said, like the artificial intelligence. So artificial intelligence is allowing us to now view these images in a much broader context. uh, for a young pathologist that is just out of practice, if there is a tool that can tell them that, like, this is the place where you want to look for to see for the where the cancer is or where the metastasis is, it will definitely enhance their work. So rather than calling it artificial intelligence, it is always better to call it augmented intelligence, because what it is doing, it is augmenting the work of the pathologist. Many pathologists fear that if artificial intelligence comes in, they will get replaced because the AI will make the diagnosis. But that is something that you shouldn't be worried about at all, because the AI is always a very limited kind of AI. It can like either tell you whether this is yes or no. It cannot like tell you if it is no, what is it?
Right.
It is the pathologist that will always make the final call. So for pathology, it is more like an augmentative tool that will help them do the work in a much better way, in a much more efficient way, and a faster way.
Correct. So, what are the critical factors to consider when selecting a digital pathology platform or a vendor?
Like there are many different aspects that come to like when you want to select a digital pathology vendor. Like the first important aspect is like what is the use case? Like are you going to use it for making a primary diagnosis? Are you going to use it for a consultation services that you're going to provide? Are you going to use it to share your data with AI companies and with pharma companies or with researchers to use the data? Are you going to use it for education? So there are very different use cases that can happen. Or are you going to use it for everything? Like if you look at an institute like All India Institute of Medical Sciences in Delhi, where
Right.
you are, they have a big mandate. They want to train doctors. They want, so that is one part of their mandate. They want to provide the best kind of clinical services, so that is another kind of mandate. They want to provide a best kind of consultation services, not only to Delhi but to the entire India and maybe the entire Southeast Asia, where people might want to send cases to All India Institute of Medical Sciences because they are the premier institute in India. So that is a consultation services. They work with researchers that are working within All India Institute of Medical Sciences. They are working with researchers that are based out of IIT in Delhi. They are working with AI companies that are based out of India. So there is a lot of different use cases that can happen when they want to use digital pathology. So in that case, they definitely need a vendor that can help them understand all these different kinds of use cases, so that they can provide the right kind of solution. And also, like very critical is for a pathologist and for AI vendors, or for people that are providing a pathology digital pathology solution, is to understand that for a pathologist, if you provide them with an AI solution that is not connected to the lab information system where they are going to sign the case out, or where the data where they're going to see the patient data, then that AI solution is of no real big use, because it can be used for some kind of a research tool. That can I like can I use it for some kind of a research protocol. But if I really want to use it in my daily practice, I need the AI tool to be available when I'm looking at the patient's slide along with the patient's data that could be coming from the EMR. So the EMR is the place where all the patient's previous reports, the radiology data, and all that is residing. And then the lab information system is the place where the patient's pathology data is residing. So everything has to be connected. Like we have to make sure that the IMS solution that the vendor is going to provide is also connected to the lab information system, is connected to the EMR, so that I can see the entire context of the patient's information. And then when I see all the context, then I can use the AI module in the best possible way. So the vendor has to be able to like make sure that they can also not only provide a platform, but they're also very good at networking. They know how to network between the IMS, the EMR, the storage solution, all of that networking processes. Storage is a big issue in digital pathology, because each slide that you see in digital pathology can vary from 500 MB to almost like 5 gigabytes in size. And if you look at like a place like MSKCC, which is the Memorial Sloan Kettering in New York, they produce 5,000 slides in a day.
Mm.
So if even if you take like an average size of 2 gigabytes per slide, 5,000 slides in a day, 2 gigabytes translates that to almost like terabytes of data. So like how are you going to store this huge amount of data? And if you are opening up a 2 gigabyte image, there is a lot of bandwidth that is involved in opening up a 2 gigabyte image. So what is the appropriate bandwidth that you need? What is the appropriate storage solution that you need? So a vendor has to be agnostic about all of these features when you're trying to create a solution. It is not only opening up a slide and just viewing the slide. So it's
Right.
not only a viewer. The viewer is just like one part of the entire solution. So networking, storage, viewing, use cases, sharing of data, all that needs to be taken into consideration. And you have to select a vendor when you're talking to them, like they should be able to like talk about all this when they want to provide a right kind of solution for that institution based on the use case. So that is very critical to understand when you select a vendor.
Right. Very well explained, sir. So, what are
Yep,
the
sir.
advantages of virtual IHC multiplexing in digital pathology, and how can it be used to streamline workflow and enhance diagnostic capabilities?
So again, like these are different use cases. Like I said, again, like we come back to like what is the use case that you want to use digital pathology for? Like we already talked about the use case in the primary diagnosis and in the consultation services. But then now there is so many advanced technologies that are coming up that can help in make even a pathologist making the right diagnosis, and obviously in the research setting and also in the treatment setting. You are now seeing a lot of AI modules being built that can actually help a clinician and an oncologist by using the digital slide to predict what is the prognosis for the patient or
Yeah.
what is the right treatment for the patient. And this prognosis and treatment part is based on a lot of multispectral imaging, because they are looking at different kinds of like if you take a case of a lymphoma, they're looking at the different kinds of cells within a lymphoma case, like what is the ratio of the CD4 to the CD8, what is the ratio of the CD20 cells. Or if you're looking at a lung adenocarcinoma slide, there are all different kinds of underlying molecular changes that are predicted based on the tissue type. And the multispectral imaging allows you to see all the different types of tissue in a single slide in one image. So what in a multispectral imaging, the CD4 cells would be seen as an orange cell, and then the CD8 cells might be seen as a blue cell. So it allows you to see the ratios of the CD4 and the CD8 cell, because you're looking at the ratio of the blue to the red cells, or it could be like 5 different kinds of cells that the multispectrum allows you to do that. Now also, not only so the digital imaging allows you to see that in that context, which you would never be able to see on a glass slide. So the digital image allows you to see the context of the different kinds of cells and tissues within the image. But now there are AI modules being built in the backend that can take this multispectral image and predict like what is the ratio of the cells, what if this is the ratio, what is the prognosis for the patient, if this is the ratio, what is the treatment for the patient. So you can see like once you start using this multispectral imaging in the context of viewing the slides, in the context of AI, you're not only helping the pathologist make a better diagnosis, you're now helping the clinician and the oncologist to like predict the right prognosis for the patient, the right treatment for the patient. And now the pharma companies are also very interested in this because pharma companies produce a lot of companion diagnostic drugs.
Correct.
And what is a companion diagnostic drug? It is a drug that is based on the underlying molecular alteration within that cancer. So, for example, if you look at breast cancer, previously there was no drug available for a patient that had a low HER2/neu.
Yeah.
If the patient had a high HER2/neu, there was Herceptin and other kinds of treatment available. But if the pathologist said that this patient has a low HER2/neu, like the HER2/neu score is 0 or 1, then the patient would not be able to take that drug. So now there is a drug that has come out from AstraZeneca and from Daiichi that actually is available for patients that have a low HER2/neu uh, uh, on the slide basically. So there are AI modules now being created that can actually look at a digital slide of even an H&E image. Not they're not even doing the stain, but can now predict from the H&E image whether the patient has a low HER2/neu. So the pharma companies are also now becoming very interested in all this because now they can use digital pathology for predicting the underlying molecular alteration and also like using the multispectral imaging predict what kind of drug is going to work for this patient. So multispectral imaging, immunohistochemistry, all these technologies are now enhancing the pathologist approach to making a diagnosis, but also enhancing what a clinician and an oncologist do for the patient. So there's a lot of different use cases where multispectral is now going to come into for helping in making a better diagnosis and also helping in predicting treatment and prognosis for the patient, and then
Correct.
allowing them to use companion diagnostic drugs.
Correct, sir. So from augmentation to predictive. Correct.
Yeah.
Right. So, my last question is, what future advancements do you foresee in digital pathology, and how should labs prepare to evolve with these innovations?
Like the future is now moving to like there are two or three very big areas of advancements that are happening. So like if you take the first area of advancement is where artificial intelligence modules will be in place where they can predict some kind of diagnosis for the digital slide. So in that if you look at that space where the things are moving is for the pathologist, like when they come in the morning, right, rather than just giving them this whole list of cases that you need to go through, the artificial intelligence modules will now start running before even the pathologist comes in, and they will put the cases in some kind of order basically, like this is a case that could be cancer, this is the case that could be benign, this is the case that is urgent, this is the case that might need some immunohistochemistry, and put them in different boxes. So for the pathologists, when they come in the morning, they are able to see the cases that need urgent attention. So like this is the case that could be malignant and the patient might need some additional testing to like make a diagnosis. Even if the artificial intelligence is right only 80% of the time, it doesn't have to be accurate all the time. It is still a big help to the patient, for to the pathologist, for at least 80% of the cases. And in those 80% of the cases, the report can be signed out much faster. And for the patient, so if you talk to any patient, like what I like, we have done that. Like, what is the most difficult part for you? And they say the most difficult part for us is to wait to get the report. Like we know we have the biopsy has been done. They have taken a tissue of my lung. They have taken a tissue of my brain. But now I have to wait till the report comes in basically.
Right.
And that is a very, very stressful time for the patient. So if you can reduce that stressful time, it is a big advantage to the patient. So there are systems now being built where you could arrange the cases for the pathologist to see them early, because at the end of the day, if I see a case, let's say I'm looking at 102, like in a normal day, I see around 150 biopsies in a day.
Hmm.
And if my 149 biopsy is a case of melanoma, most of the times I'm just going to put it aside that this is a melanoma case. I'm not going to make this diagnosis at 5 in the evening. Let me come back in the morning tomorrow and then I'll look at this case again. So already 24 hours are gone before I even look at the case again, basically. So if there was an AI tool that had shown this case to me as the first case in the morning, then that case would have been processed that same day, and the patient would not have to wait for another 24 hours to get the diagnosis. So you can see there's a big advantage here that will happen when these kinds of tools that will be available for pathologists in the near future. So that is definitely happening now. These things are coming, and we have to be cognizant of the fact that we don't need the systems to be 100% accurate. Like, people are always worried that the AI will replace me, but these are just like augmentative tools that are just making your work more efficient. So that is one big change that is going to happen in the next couple of years. Not next couple of years, in the next 1 or 2 years actually. The other big thing that is happening is generative AI. Like, you are seeing a lot of generative AI tools now coming into every part of our life. Like, not only healthcare, but every part of our life. But in healthcare, like, there are generative tools that are now coming in where that can help a pathologist generate a report, where they can help a pathologist make sure that they can catch the errors before the case is signed out. So those kinds of tools are going to become part and parcel of our practice. Like, whether we like it or not, those are going to become part and parcel of our practice. And that is one thing I keep telling every pathologist. Like, when I go to meetings, I tell them there is no point in like behaving like Gandhiji's three monkeys. That I don't want to talk about it, I don't want to see it, and I don't want to hear about it. You have to you
You
have to
have,
get involved. You have to be
yeah,
part of it now, because this is coming. And if you can take control of this and you can like use it in the best possible way,
yeah,
it will make you a better clinician, it will make you a better pathologist. So, like, catch the bull by by its horns, understand how this technology works, how I can take advantage of this technology and apply it to my field. It could be a pathologist, it could be a radiologist, it could be a clinician, whatever the field is. But understanding this technology's advantages and limitations, there is a lot of limitations also to this technology. So you have to understand these limitations, understanding them and then using them in the best possible way. How do I create a very spectacular report using these technologies? Like, I know what the diagnosis is, I know what I want to tell that clinician, but sometimes when I try to transmit this information in a report,
yeah,
I'm not the best person to do it, sometimes because of lack of experience, because of lack of that English language. But now these tools can actually help me produce a report as if it is coming out of Harvard, as if it's coming out of John Hopkins, because I can talk about the features in the generative AI system, and the generative AI will actually then transmit back or take all that information and put it in a way that it is very comprehensible.
hmm,
So you can start using these tools to your advantage right now.
hmm,
There are tools that can like look at information within the EMR, look at information within the LIS, and then look at information that you are reporting in your report
hmm,
and make sure it is all matching up.
hmm,
Like, you have seen sometimes, like, the biopsy was done from the right hand, the report says left hand,
hmm,
and then there are sometimes patient gets a wrong surgery basically, and there are systems now available where it can easily match up all things, and before you sign that case out, there is going to be a flag. Oh, there is this thing is not matching up. Just please go back and look at, like, make sure that everything matches up basically. So the pathologist then just can look in the EMR, can look at the uh, LIS, and then look at the report and make sure everything is matching. A very simplistic thing, but it can be a big thing for one patient basically. Even if this is happens in 1 in 10,000 cases, for that one patient, it is 100%. So
right.
you are avoiding a big mistake for that. So there are all these generative AI tools that are now coming into your practice that are going to completely change how you practice. But you have to get used to them, learn about them, and see how you can use them in the best possible way.
Right, sir. So I believe that embracing digital pathology with advanced tools is really crucial. And by selecting the right platform and preparing ourselves for future innovations, we can definitely increase our accuracy and efficiency. Thank you
There is no
so
doubt
much, sir.
about it. Yeah.
Thank you. Thanks for joining.
Yeah, welcome.